Okay, I believe we're live now. I can see we have some participants, which is great. Welcome, everybody, as we roll through the afternoon. And my role starts to decrease, so I can sit back a little bit and really digest the panels fully, because we have a moderator for this next session, which is the, I'm going to make sure I get this right, the Diversity of Open panel. And I'm pleased to introduce a friend of Go Open Data, been involved with us in a number of things, including conferences and webinars and the like. I don't know if any of you are getting the digest, which is a weekly product that Stefaan produces. It's well worth signing up for. And also, Stefaan is the co-founder of the and chief research and development officer and director data program at the GovLab. So, my God, you're into a lot of things, and it's all wonderful. And it's always a pleasure to introduce you and welcome you. So, Stefaan, you have the floor. Take it away, sir.
Thanks so much, Keith, and always a true pleasure to be part of the Go Open Data Conference. And also, Keith, I'm always impressed with your setup, which I have, which inspires me that I should do better next time when I'm coming back to the Go Open Data Conference. But again, I'm delighted to convene this panel, which is indeed a panel that will focus on the diversity of open data. And we have a really amazing panel that will look into the different angles on how open data can be approached, but more importantly, take stock of to what extent can open data flourish if you don't have an environment, a culture that actually embraces open and that also embraces the diversity of open. Because to a large extent, open data is at the center of a larger discourse about openness versus notions of control. And I think it's really interesting to see whether, in order for open data to flourish, whether we actually also need to have other approaches to open, such as open source, open science, open government, that need to be in place in order for open data to flourish. And so what we will focus on today is on a variety of openness environments, the diversity of open as such. And so with that, let me introduce the panelists. And if I could call upon all the panelists to put on their camera. We first have Dr. Na-Koshie Lamptey, who is the Deputy Medical Officer of Health in Toronto. And she has a real passion for public health and preventive medicine, with a particular focus on ensuring that healthcare is equitable and that we indeed need to address with the inequities that exist within public health and clinical health as well. Then next we have Natalia Carfi, or Nati Carfi, as we have come to know. And I don't know whether Natalia actually needs an introduction, but she is, of course, the Executive Director of the Open Data Charter, which is quite often the reason why we're all here, because the Open Data Charter actually has been the lead instrument globally to keep open data on the agenda as such. And Nati will also reflect on some of the work that she's been doing as it relates to climate. And then, of course, Jackie Liu, who again is for this audience probably not a stranger. Jackie Liu has been in the open data community for quite a while, initially at New York City, but then, of course, more recently, she created her own organization called Helpful Places that really tries to establish trust in how we go about leveraging technology in places and spaces as such. So with that, let us get started, and let me call upon Na-Koshie to really give us an approach and an understanding of what the diversity of open means within a healthcare context. And so over to you, Dr. Lamptey.
Hello, good afternoon. It's my pleasure to be here. And I hope that we're going to have a great discussion this afternoon. I'm just going to check whether you can see a slide.
Yes.
Great. All right. Well, I'm here representing the city of Toronto, and today we just had an interesting pronouncement from the World Health Organization indicating that the COVID-19 pandemic is no longer an event of international concern. But I am going to reference that because it's in our recent living experience about how some of the ways we had to learn and adapt quickly to be open, to respond to really the biggest public health issue facing our city in the last century. So as we look forward, we're actually at an interesting time here in Toronto. This year marks 140 years of public health, or Toronto public health in the city, and that's 140 years of the city administration really putting organized efforts into protecting and promoting the health of the population in Toronto. And that's almost a century and a half that we've been doing this. And when I look at this visual from the summer of 1919, you know, there's some things that I see similar across the years. So if you recall 1919, at least probably many of you weren't alive a little over 100 years ago, but if you recall from our history, we know that that was the year in 1919 where there was another pandemic that was coming to a close, and that was the influenza pandemic that circled the globe after World War I. And here is a hand-drawn map of infant deaths in the city of that summer. I don't actually know the causes of those deaths. Because they were infants, I imagine influenza could have been a contribution, but also probably diarrheal illness, because this was right around the time we were making some very concerted efforts in public health to protect health through some things that we now take for granted, like clean drinking water, like pasteurization of milk, which all put a rather large health burden on infants. So you can see that the map is hand-drawn and that the dots, which represent the deaths of those infants, they're not evenly distributed in the city. And then when you turn your attention to this map on the right, you can see also that there's not even distribution. These are COVID deaths that were cumulative in this pandemic to just a couple of weeks ago. And we see that similarity across time, that health conditions aren't always clustered in this evenly. And even though we're talking about 2 centuries, 2 pandemics, 2 diseases that decrease life expectancy in Canada, the work of public health, you know, has remained the same, which is to try to lengthen and improve the life of our residents. So I just thought I'd talk a little bit about many of the things that we look forward to in terms of healthy life in Canada and increased life expectancy are actually public health related. And I wanted to point this out because as a municipal department of health, we have health professionals like physicians like myself or other associate medical officers of health, of course, the great Dr. Davila, our medical officer of health, but we also have professionals like public health nurses, public health inspectors, epidemiologists, and others. But we have a different role in the clinical care system. The clinical health care system focuses on the treatment of disease and illness of individuals, one person at a time, one healthcare interaction at a time. The public health system is really focused on improving the health of the whole population and reducing health inequities through prevention and techniques that focus on groups and communities to keep them well. So there's no question, healthcare is important. It is one of the reasons why we've increased life expectancy in this country, but it turns out that there's many other things that are also important to improving health. And many of those are related to public health. So why is that important, that distinction? It's because the kinds of information that would allow us to make those improvements at a population level have to be necessarily slightly different than the kinds of information that are collected in the healthcare system. We can learn a lot, for example, by looking at who visits the emergency room, who's hospitalized, who's going to their family physician and why they're going. But actually, when you look at the whole population, the burden of illness, actually most of it falls on people who don't actually interact with the healthcare system. So if you just think about if you have ever traveled to another country and maybe you ate some delicious street food that wasn't inspected and you enjoyed it, and then came home with a diarrheal illness, not probably everyone who experiences that is going to go and get tested and see a doctor or end up in hospital, but that still represents a burden of illness that's in the community. So public health has to look at a broader set of pieces of information than just what we see in healthcare. Another point is that we have to operate at a different scale. We have 2.7 million residents in the city of Toronto. So when we're looking at information, sometimes it's in the low digits, like we just announced there was a measles case in Toronto last year, and that is an urgent issue because one case of measles can represent a threat because it's so communicable and so infectious. But most of the time we're talking about things that are on the order of tens of thousands or even hundreds of thousands of data points at a time. So if you look at just one of our age cohorts, if you think about the COVID vaccine program, it came out in age groups of first older adults, and then we dropped down in age, and then we finally had some products for adolescents, and then for children 5 to 11-year-old. If you look in Toronto, because we have 2.7 million people, any one of those age bands, you know, is a small city in of itself. Our population of 5 to 11-year-old is as large as some other whole cities. We really need to be able to have systems that can operate at scale, that can synthesize different kinds of information to get a whole picture of health, and that can really get at the underlying drivers. So with the next slide, I'm just going to talk a little bit about an example of trying to increase our understanding and implications of a public health issue by using information from other sectors. So I talked about that map, you know, we saw some patterns in 1919, some patterns in 2023. And now there's some, you know, new and increasingly urgent issues. We saw how the opioid crisis really intensified during the pandemic for a number of reasons. I think the interesting thing about this map is it represents really how opening up our mind and our interactions to other sets of data can bring new perspectives on what's going on. So this is a municipal data set. This is not really a healthcare data set. This is a municipal data set about services to Toronto paramedic services or ambulance calls for opioid overdoses. And you can see that it's showing that there's a real concentration of overdose calls in the downtown core. Now that then is able to drive response to that area. And in a similar example is earlier this year, looking at data sets on what was happening in our transportation systems, and then sending some very directed services to where certain patterns were occurring. Because, you know, in a city as vast as ours, we can't do everything everywhere all at once. I still have not seen that movie though. Okay, this slide talks about the fact that one of the key components of public health, or the key functions we play, is trying to diagnose health issues at the population level. So I tell people that, you know, in family practice, I was able to invite patients to come see me, have a chat with them, say, how are you doing? Hear about what their concerns were, formulate what I thought was going on, do a physical exam, if required, do investigations to come up with a treatment plan. And the investigations would often confirm the working diagnosis you had. Well, you can't do that with 2.7 million people all at once. We have to use different techniques. And that includes looking at large pieces of information to describe the patterns of what we're seeing at the population level. And then reporting out the diagnoses to the population so we can come up with community-based solutions to try and address and improve them. So this is an example of a population health report that was just released by us earlier this year. And we knew it was necessary because we suspected that the population's health had changed because of the pandemic, and we did find that. So here you can see one of the highlights is that the mental health status of the population did decrease, and some communities, some groups were more affected by that deterioration. I'll show you on the next slide that as we look at the health of the overall population, I talk about this requirement to be able to zoom in and zoom out all the time, because we have two components of our mandate: to improve overall health and make sure we don't increase inequities. No one's better off if there are people left behind. And COVID was a classic example of that. As long as there are people who weren't protected, there was a risk to everyone in the community. So you need to be able to have specific sensitive information to be able to do the granular disaggregation and analysis to know where there might be groups or people or communities or neighborhoods that require extra effort to take advantages of health opportunities. So this is an example of COVID dose 1 vaccination coverage in the northwest area of the city, where we know that because of the living conditions of many people there and their working conditions, they might be doing work that cannot be done remotely. They might have to rely on public transit, noting that there's not a subway line in this part of the community, more crowded housing, that they're at more risk of exposure to COVID and more severe outcomes, including conditions of crowded housing. And we could see that there was a gap in those immunization rates compared to the rest of the city. With the information and the constant reassessment of that, with some focused efforts, you can see here that there were double-digit increases in the vaccine coverage with that focused effort that exceeded the gains that were occurring in the rest of the city. So with that target information, you can make a difference. Another thing we learned in the pandemic is that people really want to be able to interact with information. It's not enough to release it statically. People want to be able to look at it, manipulate it, analyze it, provide meaning on their own. So you can see here, I've circled here that this is an example of our COVID-19 monitoring dashboard, that we allow people to download the data, interact with it as they wanted. But the other point I wanted to make on this slide is that this is an example of how it's important to provide some meaning for information. Particularly when I was talking about the earlier point in trying to achieve health equity, as much as we need to be able to identify gap, we have to be careful that we provide it in a way that's not going to compromise the trust of communities that are historically either over-surveilled or under-surveilled and have suspicion. But that also when you get a new completely health issue like COVID was, that we also provide some meaning around this. So this was developed after the emergence of Omicron, where we couldn't rely on lab testing like we did in earlier waves, because it was just so communicable and only a very small percentage of people were getting tested. So to really understand COVID activity was not just about lab confirmations anymore. There were new data sources like wastewater surveillance that had to be put together in the picture to say, well, our assessment of COVID activity is not based on one data point. It's about the constellation of information as presented here, and allowing the public to be able to interact with it and interpret it on their own. Another important concept of openness is seeing the community as a partner to bring meaning and to help disseminate information for people to use. And so one of the programs the City of Toronto had was community ambassadors, which are lay people who were tasked with giving people information about resources they could use to protect themselves against COVID, even before the vaccine, and to be able to explain prevention messages in culturally appropriate ways. And it was a two-way interaction. They also reported back to the health department and to the city about what they were hearing. People were curious or concerned about where needs were, so that interventions could be adjusted to meet those needs. And there's just no way that as a government, there could have been the penetration of that without people on the ground who were in these neighborhoods and who were trusted. So, in conclusion, what I would say is that, we do have to think about the way we collect and use this information in multiple ways. Also, not just thinking about qualitative information. The community ambassadors gave us a lot of qualitative, important contextual information. And just to show how, information and statistics are powerful. We have that statistical term, are we powered enough to detect a difference between the null hypothesis and not? Well, there's actually greater power in making sure that it's grounded in relationships that involve exchange so that information is accessible and interactive. And I put this graphic up because it was precisely the things that we learned in COVID that allowed us to respond to another new pathogen in North America, Mpox, this past year. And here you can see this is probably very standard in other enterprises, but it was groundbreaking for us as a health department to be able to reach people by text. We had to have the data and then the information systems, to alert them to resources in this way. And I think this just kind of summarizes what I talk about, that you need all these things to open and exchange. And I'm just going to make a bridge to the next speaker that I've called this pandemic potential to climate concepts. We just went through a very challenging experience of 3 years. Climate change is going to be the challenge of our generation. So what we can learn most recently, hopefully, will help us tackle and respond to that new generational challenge. Thank you.
Great. Thanks so much, Na-Koshie, for really providing an overview of indeed diversity of openness, both at the level of collection, but also engagement, and also openness to different data sources, including non-traditional data, but also lived experience as such. And I think it's super interesting, and wished we had more time to actually engage as well, but we are running short. So let me go straight to Nati. And indeed, if you have questions for Dr. Lamptey, please add them to the Q&A, and then I will try to come back to them at the end, where we hopefully will have some engagement with the audience and with the panelists amongst themselves as well. Over to you, Nati. I think Na-Koshie set the stage for you with regard to climate. So
thank you.
up to you to take the stage now.
Yeah, I'm gonna quickly go through the process of sharing my screen, which is always okay. You should be seeing my full screen. So I'm Nati Carfi. I'm the executive director of the Open Data Charter. We're a global civil society organization that works with governments and civil society organizations from around the world, and we've been developing thematic work since 2017, and climate change and open data has been one of our main topics of work with governments throughout the world. We've developed, alongside with the World Resources Institute and with the help of the Inter-American Development Bank, a tool that is called an Open Up Guide, which actually tackles high-value data sets that governments should open in order to promote an open data policy around climate change and climate justice. We worked with the vision that there was public value that was being kept locked, if you will, within the reporting mechanisms of the Paris Agreement. So a lot of national governments have signed up to the Paris Agreement. They do have reporting commitments. They do create the reports to send out to the UN system, but they were not opening up that data. Which types of data are we talking about? So here you're seeing kind of the clusters of the data that we've been working on. So emission-related data, agricultural data, electricity data. As you see, there's a whole variety of data sets that are not created within only one office within government. So there's always a leading office to work around climate change in every government, in every national government. But the data that relates to climate change actually is created horizontally all throughout different ministries, as you can see here. So transportation ministries, infrastructure ministries, economy ministries are also very important to have a proper conversation around climate change. What have we done with the Open Up Guide on climate change? We actually implemented it in Chile and in Uruguay at the same time, just trying to find which challenges they met that were similar, which challenges they met that weren't were contextual, and also trying to understand how the open data communities could work with the government and also understand the demand side of data. What we found out is there was a lot of data to be open. Of course, the first steps of walking through this process, bringing in not only the open data teams, which were of course already buying into the idea of opening up data, but also bringing in the environmental teams, the climate change teams, the ministerial teams that needed to be engaged, as I said, horizontally throughout government. And of course, the first responses that we got were rather exact, like, why do you want this data? Why does anybody want this data? We're working to report on this. This is a lot of work. What are they going to do with this data? And I didn't have an answer, because we're opening up the data and then the possibilities of reuse are infinite. So we went through all that process of, if you will, cultural change that needs to get done when you're talking about open data. It's not just the technical bits that needs to be solved. but we always say that that we are talking about a cultural change whenever we're talking about an open data policy. So after this first implementation and getting the first open data sets out, we actually worked with Uruguay on a data reuse, data challenge innovation in Uruguay. We launched this data innovation challenge with, of course, the help of several governmental offices within Uruguay, calling upon mostly university students, but anybody, it was open to anybody, but we tried to target university students to bring in new ideas on how those data sets could be reused. We went first through a series of presentations to try to explain the data sets that were being opened, because there's a technical burden there behind data sets on climate change. Kind of the climate change community perfectly understand what they are seeing, but it's not that straightforward with data folks that are not related to climate change. So we went through a whole process of workshops with all the governmental offices. We selected a couple of teams that went through an incubation process, and then we ended up with one winner of the whole challenge that then went on to win other prizes with the same project that was selected as the winner. But so to showcase that it's not only about opening up the data, but it's also about engaging with the community, explaining the data that is being opened, accompanying those process of data reuse, and collaboration, not only inside of government, but collaboration between government and civil society organizations and citizens. And let me go really quickly through the core learnings of this whole process within the work that we've done on climate change, and specifically in Uruguay in this case. There is indeed public value locked in the data that governments were creating for reporting mechanisms. So now we do have really hardcore open data folks inside of the environmental ministry in Uruguay. The reporting team is all for open data, and now they're opening up a lot of data sets as we speak. So that was an amazing process that we went through with them. Then the other finding that we got from this is that the Open Up Guide, the tool that we developed with the World Resources Institute, it was a sound tool to get the conversation going, to connect areas that hadn't been collaborating at all, or not in such a connected way. So having this kind of umbrella of discussion, we're going to talk about this and this data sets and about all these topics, kind of set the expectations for everybody, download kind of broadband anxiety that they might have, like, why do you want this data? All those types of questions were kind of answered by understanding that the guide was the Open Up Guide was actually the umbrella that we were talking about. Then we understood, for example, through this process, that the Open Up Guide actually needed more oceanographic data. Both Uruguay and Chile have really huge coastal lines, so more data on oceans needed to be included in the guide, and now it is. And then one of the core things that we learned is that on climate change specifically, there is super technical types of data that are being created. And as I said, for the climate change community, that is really easy to understand. But even the most data savvy organizations in Uruguay had to go through the process of being accompanied to understand what they were looking at when they were looking at the data sets. So this collaboration and even translation of the data set, was detrimental to the data reuse process. So collaboration and as I always say, interoperability of people, not only interoperability of data, is critical to actually really unlock the public value that open governmental data has. So making those connections, bringing everybody into the conversation, and actually working together, bringing in their expertise to reuse that data was critical to this whole process. So the open government perspective of this open data policy was detrimental to its success, and that's what I wanted to share. Thank you very much.
Thanks so much, Nati, and always super interesting the work you're doing with regard to open up, but also those open challenges to actually tap into different types of expertise. I think is another kind of diversity of open. So let's go to Jackie, and I think we've heard a lot about open data. But quite often there is also lack of openness on how data is actually being collected. And so you have this kind of information asymmetry. And I think that's something that you've done a lot of work on how do we actually open up our understanding of how data is being collected. And so eager to hear from you, Jackie, the diversity of openness as you have approached it.
Great, thanks. And I really love it as a thread from what Nati was just saying around like having that umbrella for discussion, helping set expectations and having frameworks and tools to foster collaboration and dialogue is actually just so important. And oops, hang on, technical challenge, shared the wrong thing, which is always fun. Okay, so here we go. We're on the slides now. And yeah, as Stefaan, thank you for the intro. I want to talk about the need for openness when it comes to how our public spaces work and some of the barriers, how we're trying to address that through some of our work and the barriers that we see for sort of actually achieving that openness. And so as many of you know, digital technology is increasingly embedded into how our cities work. It's a massive global industry. And it is really problematic because it's really difficult for most people to understand who is accountable for that technology, never mind what we all aspire to, which is how can that technology and the data that it's collecting help us actually get to better outcomes. And this, I think, has created in its own way sort of interesting challenges when you aspire to openness. And so for me, this dialogue all started back in New York City, actually in 2016, when we were piloting Wi-Fi sniffing smart benches. And what I really noticed there and sort of started realizing is that, this is actually this idea of sort of needing to have discourse around what technology is doing in our shared spaces actually follows on a long tradition on sort of like how communities have actually always been active in discussions of how shared spaces or public spaces should work. It's just that now that the conversation necessarily extends to the technology that's embedded in those places. And that public conversation really increasingly focuses on how that technology is creepy, because these technologies do have the potential to be forms of surveillance. And so I think when we as sort of technology optimists or as organizations that seek to sort of leverage and sort of reap the benefits and sort of see the beneficial sides of data and technology, we might aspire to transparency and engagement. But there's a real implementation gap. And I think the sort of elephant in the room is that we should recognize is that it's actually exactly this type of public reaction that can itself be a barrier to further openness and transparency, because because the conversation's polarized. We're not meeting in the middle to try to gain a sort of common understanding. And this sort of gap in public distrust and actually really the emotional dimensions of this power imbalance around technology and data was even called out recently by the American Planning Association, talking about how really designing digital trust and thinking about public spaces need to go hand in hand. And so I think while there are mechanisms in Canada, we have privacy regulations. Those privacy regulations are intended to be protective, but they don't result in depolarizing the conversation. They haven't resulted in making technologies more understandable to the public or empowering people to ask questions and provide feedback. And then in the United States, where there is to be determined privacy legislation, what you're seeing are legislative responses that really focus on limiting potential harms rather than elevating understanding. And so I think what we're really doing and what's happening is that we're sort of feeding this really challenging cycle of polarization that is hard to break out of and can be tricky for openness. And I think this question of sort of like promoting a shift in cultural awareness. I think in the public sector, we've always talked about, when I was in the public sector, we always talked about how change management is a key to digital transformation. And I think in the context of this, how are we bringing the community along as well as these spaces actually change? Because I think it's this lack of legibility that is both itself a lack of openness, but then a barrier to further openness. So it's sort of like a interesting little cycle that we're in here, because I think we all aspire to co-creation when it comes to being able to use technology and data. But I think even when, sort of pulling on sort of well-known frameworks for public participation, what we have, if we're seek to sort of collaborate and empower, the gap in this context is actually a systematic way to even begin to inform, so that the dialogue can then move up this ladder of public participation. So it's like, if you want to aspire to openness so that you can sort of collaborate and empower and co-create, but that in and of itself is that sort of legibility and information is unattainable. And so one of the frameworks that we're advancing at Helpful Places is really based on this idea that visual language can help democratize these complex concepts. And what we advance is an open source sort of communication framework that's designed to communicate and be that sort of wayfinding for technology in public spaces. And so it supports a user journey that sort of looks like this, where you can arrive at a place that has sensors or has data collection technology, and you walk towards a sensor, and here's some information, some light information about that technology. And you can basically increasingly go deeper and deeper along these streams of information to give feedback and ask questions. And we've actually piloted this framework at this point across Australia, North America, and France. And we are sort of seeing sort of like, it's been interesting to see sort of these organizations work with the sort of work through the seams of sort of advancing a transparency and openness standard like this when it comes to their sort of use of data. And I think the sort of main insight that I want to share is that when we have a framework that sort of moves with transparency first, what we saw in our pilots is that by the simple act of sort of talking through and moving through the motions of like putting out a sign has really sort of identified the sort of need and how different traditionally siloed work streams can really come together and should come together. And these, when we talk about technology in physical spaces and in cities, it's like these like place-based design and operations, like facility managers, technology implementation and innovators, so the technology sort of division or the vendors, and then community and stakeholder engagement. And I think that what we're sort of seeing is that to achieve this aspiration of openness and transparency so that we can sort of have that collaboration, there's actually a really deep need to streamline and systematize these internal processes. And so I think this is where I'm just going to sort of leave this for Stefaan. I think we're trying to cover a sort of broad array of like talking about systematic and organizational barriers to openness, a few different approaches on how sort of openness has been addressed. But yeah, I think it's like basically, I think while openness can be aspirational, organizations really need tools and frameworks that can be deployed and redeployed in a way that enables their own internal learnings and helps them see the sort of barriers that exist in their internal organizations to sort of achieving that principle. And so, yeah, that's actually just my last slide. So yeah, that was it. I'm done. Try to go fast there, Stefaan, so you leave some room for discussion.
Yeah, no, thanks so much, Jackie, because yeah, I'm worried that we only have 45 minutes for a very, very rich topic of different notions of openness, and especially in different sectors and different contexts. And but this has already been super interesting for me, but I do want to come back to, I think, the common theme that all three of you have emphasized, which is this notion of cultural change, or change as it relates to how you go about business, how you go about public health, how you go about climate data, how you go about sharing information around collection and new instrumentation of data collection, for instance. And so eager to hear from the three of you on what has been kind of a key approach to instigate change as it relates to openness from a cultural perspective. And so Na-Koshie, I can imagine that anyway, the public health sector typically, and especially the health sector in general, right, has typically had this culture of confidentiality, right, which quite often is misinterpreted as, anyway, we cannot share anything, or we can only share in a way that has kind of a high barrier. And so eager to hear from you what has been some kind of a element that opens up the culture or makes the culture more inducive for new versions of openness, right? Including sharing and engaging with the community at large, including, for instance, openness to new data sources, or including, of course, this whole notion of openness to actually leverage citizens and their data and how they share the data. Because in the past, I did a lot of work on healthcare. It was always like, can we trust the data that people share because we didn't collect it? And so how do you go about that kind of openness? And then same question for you, Nati. You mentioned, and this is actually something that Anna, who is on the next panel, and I have written about in the past, is that for open data to flourish, you actually do need to have kind of an open government environment. And so eager to hear how that works out. And the same for you, Jackie, is that, anyway, what's the change that is needed from a cultural perspective for actually becoming more transparent, especially if, as you rightly said, sometimes being open actually means that you might get you might become critiqued of the practices that you have instigated, especially if you were not transparent by design, as you rightly have outlined as well, right? And so I know hard questions, and we don't have much time. So if you could really focus on like one important element that he says, look, this is what has worked for us, or this is kind of a real important approach that would change the culture to make different versions of openness more accessible. That would be great. Over to you, Na-Koshie.
Well, I would say like the public is demanding it. That's been the biggest cultural change. We just would not have been credible as an organization if we weren't sharing the information that people were asking for, because it was, no one had been in this kind of environment before. We were all learning together and people wanted to participate in the understanding. The second is, I think the results that were achieved are a big driver of change. We actually showed that it was possible to get to high levels of community protection and to reduce health inequities. That's very inspiring. We can't go back. And then the last piece is, I think, is if people participate, they will tell us how they can feel protected even as they share, right? So participatory sharing will mean that the principles of how you do that safely, how you don't stigmatize, how you don't inadvertently ascribe a phenomenon as caused by people as opposed to their living conditions or other circumstances, that participation will help change the culture to one where you can do it safely.
Nati.
Yeah, so I was just taking notes on what to answer. When you asked about like what's one of the main things to work on cultural change, the first word that popped into my mind was patience. Because you actually, like, it actually takes time. It's not that I'm saying that building up a platform doesn't take time, but I do believe that cultural change inside of government actually takes time. So as I was talking about and actually connecting all the presentations, participation, bringing in the folks that will actually reuse the data to explain why opening up that data is actually important, actually can help certain public officials understand why that data is being demanded, and also work towards creating those data sets. And then the other thing that I would say is not only patience, but consistency. Working throughout the years on kind of following the same horizon. And we can see it in this case in Uruguay. They've been consistently working towards open data, building from year to year on what they've done. And this is not a sprint, it's a long run, if you will. So patience and consistency probably are and participation are one of the most important things.
It's interesting, Nati. Yeah, no, it's interesting. And actually, it's kind of, so because it builds upon what Na-Koshie said, which as I understood it was that the public is getting impatient in actually government that is not changing in a way that can deal with major challenges. And I think that COVID was basically, anyway, a moment of urgency that led to cultural change because there was no, anyway, you could not be patient, right? And so wondering whether climate is not the same. Why is climate not seen in the same way from your point? I mean, because ultimately, if it's about climate data, I mean, talking about an urgency and a level of impatience that should be. I
do think the public is growing impatient on climate change. We are all seeing in our everyday life the impact of the delays in the decision-making process that is taking place.
But do you think climate change could have the same effect as COVID to have that level of urgency that actually changes government faster?
I would love to see that. And in certain countries, I think it does, and in other, it doesn't. It's not as consistent as the COVID pandemic was, but there are certain examples of countries that are doing a good job.
Yeah, that's my fear too. Okay, Jackie.
Yeah, I mean, I think it's definitely, I echo what Na-Koshie says, the public sort of demanding transparency and asking for it. And I think it is the impetus of government and organizations to rise up to meet the challenge. And yes, that requires patience, that requires, but I think that requires patience, but I think also it requires like bravery. It's not easy for organizations. I still remember the early days of open data when everyone was like, oh my gosh, we can't publish any data. What if everyone misinterprets it? And I think that part of enabling openness is recognizing that as a shared goal, but then being able to recognize that whether you're a member of the public or the private sector or the public sector, that no one actually knows how to do it, and to try to approach that with grace and understanding and like a sort of good intention, like sort of best intentions. It's like, you know, if we can sort of agree that there's a problem, then I think there is trying to look at ways that we can sort of demystify and align and get into the same concepts. Because I think like even with different sorts of data sets, what are the meaning? Like so much of this is about creating shared language and common understanding. And I think if we sort of focus on getting that, then the openness will come from that shared understanding and having a common language. But if we sort of stay sort of polarized in our sort of like corners, then that's when it actually gets really tough. So
great, and I do thanks so much, and I do agree with the bravery aspect, which is also why, from my point of view, one of the key challenges to culture change is actually naming and faming, right? The ones that are brave should actually be celebrated as opposed to the naming and shaming, which quite often happens, right? Because it's easier to name and shame as opposed to name and fame and then celebrate the ones that are brave. And I think hopefully that
maybe celebrate the failures too. Celebrate the bravery and the bravery,
exactly. But anyway, name and fame the ones that are stepping out of their comfort zone. And I think if there's one thing that this conference does well is indeed celebrating all the good practice. And so thanks so much, Na-Koshie and Nati and Jackie, for being brave enough to celebrate and apply openness in all your work. And I give the floor back to Keith who's getting very nervous that we would go into an whole range of other diversity of openness, and as a result, sidetrack the panel or the timing here. But thanks so much, and over to you, Kate.
And thank you, Stefan, and thank you, panel, as well. Natty, I saw your cat just crossing a couple of times. My cat has been watching at a different screen over there, and it piqued his interest, and he did hand me a note which said it'd be a good idea if Go Open Data had more animal presence. So we'll keep that in mind. Thank you, Hank, and thank you, panel. That was just awesome.